Great. Well, thanks for having me here. My name is Benjamin Locke. I'm a professor of computer science specializing in virtual reality at the University of Florida, also a co-founder of Shadow Health. And Shadow Health is an education company that's looking to better prepare our allied healthcare students. So we want to talk to you today and hopefully engage with you in conversations about specifically communication skills and clinical reasoning. And as we know, these are skills that our graduates are having an increasingly bigger gap in terms of preparation when they get out into the real world as the world gets more complex and the patients they're seeing are getting more challenging. So what can we do about how can we think about improving their skills in that? Because we know if they lack skills in communication and clinical reasoning, it challenges communications with patients, it challenges communications with other team members, results in negative patient outcomes, and it really results in errors that we're seeing. What can we do? So Shadow Health's work has really been thinking about how can we build a curriculum of virtual simulation experiences that really have these two pieces at its core, communications and clinical reasoning skills. And so that's what we've really been working on, because we do know that, for example, inability to communicate well does impact results all the way through. So what we're doing in Shadow Health, which started off as academic research in my lab about 15 years ago at the University of Florida, is to have allied health students work with virtual patients. And what virtual patients are 3D characters. We use 3D game engine technologies, so things that a lot of us students are very familiar with and are well-known technologies. And they see these characters and they can walk up to them and talk to them. They can interact, they observe what happens, they can do physical exams. And the whole time they are having to document their thinking. And so what the system does is not only provide them feedback on what they're saying, but also how they're reasoning about it, right? And so our characters, what we think about is how can we create characters that are realistic people and that have a story behind, they have a belief system, they've got personalities. And so we think about trying to create characters that that would challenge students, have a whole story behind them, right? So we have been really working with creating characters that have depth. So you can be talking with Rachel. She's a teenager that wrecked her parents' car right after she's had a little to drink. You can talk with Eric, who's an adult who's thinking he might have a heart attack. And you have to work with trying to identify what medications they're on, also thinking about how do you educate them, how do you empathize with their home situation. And so having a very realistic experience is one of the things that we're really developing. And so if you could build a curriculum around that and having students work through these cases, we can actually start tackling tough problems such as cultural competency, patient-centered care, because we're working through a variety of cases all the way through using these virtual characters. So hopefully this is something that you want to engage us more in terms of how can we think about changing communication skills and clinical reasoning skills and improving that. We're in over 1,400 programs, so we think we've got a platform that can be in front of a lot of students and really impacting how we can move the needle with that. And so we're at table one, and we have one of our characters, Tina. Hopefully you'd like to meet her and get to interact with her and get to know her better. So thank you very much.